Hello, I am urologist Omer Erdamakaya. Today I will have a short video presentation on chronic prostatitis and how a disease it is. Chronic prostatitis is the most common and most frequently diagnosed disease group in men under the age of 50. It is actually a community of complaints, symptoms, rather than a disease. With what complaints do chronic prostatitis patients apply to our clinic? Patients mostly apply to our clinic with complaints of pain under the belly, testicle, and penis extending to the anus, accompanying burning in urine, frequent urination and difficulty in urinating, and sexual problems. In patients, especially pain and sexual problems, as well as urinary problems reduce the quality of life of the patient and bring the patient tiredness of life. As the name suggests, chronic prostatitis is a condition that often fluctuates in severity, with periods of exacerbation and remission. You can think of it just like rheumatism. Unfortunately, the exact cause of chronic prostatitis remains unknown, and as a result, there is currently no standardized treatment. It is a troublesome disease for both doctors and patients. But many patients learn to adapt and manage their symptoms over time, developing strategies to minimize discomfort and maximize quality of life. This often involves identifying triggers that exacerbate symptoms and taking steps to avoid or minimize exposure to these factors. The 4-glass test is the most commonly used classification in chronic prostatitis. How is the 4-glass test done? First, the patient's urine microscopy and urine culture are taken. The patient is rubbed from the anus to the prostate with prostate massage. And urine microscopy and urine culture are applied to the discharge coming from the tip of the penis. Here, the class of the patient's chronic prostatitis is determined, and the treatment is determined accordingly. However, antibiotics are the most commonly used treatments today. We support this with prostate medications, and we add painkillers to them. But of course, when many patients receive these 2 to 3 treatments, they come back to us again at relapse. Their complaints first decrease and then increase again. Then we also give phytotherapy and herbal treatments to the patient. Herbal treatments that patients benefit from most for chronic prostatitis are saw palmetto, dead nettle, pumpkin seed, and lycopene. Patients benefit greatly from these. And I think it is necessary to add prostate massage to the treatment. According to my own clinical experience, patients treated with prostate massage get a more permanent result with a lower rate of recurrence. We do it through exercises for the floor hip muscles. We explain them, we do Kegel exercises. With Kegel exercises, the blood supply of that area increases. And we recommend lifestyle changes. Lifestyle changes are very important. The patient knows that his complaints will increase when he eats spicy, when he is constipated and when he has cold feet. He knows that his complaints will increase based on what he eats and drinks. He knows that he will have trouble when he drinks alcohol. That's why these patients definitely need lifestyle changes. Apart from these, other treatment options that have been on the agenda for the last 5 to 10 years are shock wave therapy, vitamin mineral support, and functional treatment approaches, if the first treatment options are not beneficial. In vitamin mineral support, B12, zinc, folic acid, vitamin D supplements should be given. Also, why is a functional approach useful? Also in some patients, intestinal diseases, autoimmune diseases, and chronic systemic diseases may accompany chronic prostatitis. Recent advances in medical technology have led to the exploration of novel treatment approaches for chronic prostatitis. One emerging therapy is shock wave therapy, which has gained popularity in our country for the treatment of erectile dysfunction, and is now being explored as a potential treatment for chronic prostatitis. While the results of these trials are still preliminary and inconclusive, they offer hope for patients who have not responded to traditional treatments. Low-intensity ultrasound applications have begun, which is a very new treatment. Injection of antibiotics and Botox into the prostate. In addition to these new therapies, traditional treatments such as the injection of antibiotics and Botox into the prostate gland remain important options for patients with chronic prostatitis. There is a success rate of 60 to 70%. Botox injection has been on the agenda for the last 5 to 10 years. Patients are very satisfied with this, and there are people who benefit a lot. If they do not benefit from these, psychotherapy and antidepressants can also be applied. There are also studies that say little blue pills, which we call phosphodiesterase inhibitors, are beneficial. To have the last word, as can be seen here, we do not have a clear cure for chronic prostatitis. The approach can be changed according to each patient, it can be changed according to the patient's complaints. But many patients benefit greatly from the following treatments: antibiotics, alpha blockers, pain relievers, phytotherapy, and prostate massage. In other words, they heal 90 to 95% of the patients. Other treatments can be applied for other complaints. Thank you very much for listening, best regards.